in its earliest days in 2018 and 2019, it was it was literally around a table, generally around the table that I'm sitting at right now. And we would bring together investors, we'd bring together government entities, entrepreneurs, advisors, thought leaders, and
Hello and welcome to the world's most interesting people. Today we have Taylor McPartland, CEO at ScaleHealth.
Thanks for having me. Good to see you.
Awesome. How are you doing today, Taylor?
I'm doing well. Well, I'm a little bit tired. We had our summit for the last 2 days, and so I'm both coming off of a high of being able to sit down with some amazing people in the health innovation world and have some really exciting conversations.
That's
but
awesome.
I'm dealing with some tiredness at the end of a good 2-day event.
That's great. And where was your summit?
We broke it up into 2 days. So the first day we did it entirely virtual because our ecosystem is a global community. So we did one day that was virtual for our broader ScaleHealth family, and then we had one day that was based at our headquarters here in Los Angeles.
That's great. That's great. Building a global community is definitely, a huge challenge. And, the fact that you're able to bring these people together from all around the world is an amazing feat.
Appreciate it.
So please tell us a little bit about yourself. What makes you interesting, and tell us your background.
I guess what makes me interesting is that I found myself in at kind of the nexus of health and innovation, and leading this global family of amazing healthcare wellness thought leaders and innovators. And that's not my background. My background is I'm a studio art major from a small town in Northern California, and I've found myself in this space really out of a personal drive to try to make the world as a better place and leave it better than I found it. And I think that as we look at where we're at in this society, at this stage of COVID, anything we can do to enable each other to live our healthiest lives is work worth doing. And so that's what I've dedicated myself to.
It's really interesting. You mentioned you have a studio art background. How does that sort of play into what you're doing at ScaleHealth? And, I think having a studio art background probably brings a really different perspective than the traditional, bioscience majors and others. So, I'd love to hear more about that.
I got into that path because that's really I would say if everyone has a natural skill that they're born with, my natural skill was art. And so I got into that field just because that was an area that I loved, I was passionate about, and still really do enjoy doing. But I think at the core, it's not radically that different. I shouldn't say, but it's different from healthcare, but it's not really that different from entrepreneurship. It's all this sense of if I break down what I care most about, and if I break down what I'm passionate about, it's creation. It's like visualizing something that doesn't yet exist and bringing that to reality. And so I look at that as kind of the through line of my career, whether it's painting something on canvas, whether it's previously, if people do a very deep Googling of me, it's spending time as a screenwriter and in the film industry, and then kind of now in the entrepreneurial world. The through line is seeing something that doesn't yet exist the way that I want it to exist, and dedicating myself to bringing that to reality and trying to get as close to that vision that I have in my head as possible. That's great.
And so you mentioned, bringing that vision to, into reality. You've clearly done that here with ScaleHealth. So, we'd love to, kind of hear how you transitioned from, majoring in studio art into, starting ScaleHealth. We'd love to hear that story and how you came up with the idea for building a global community.
Well, it certainly didn't start out that way. Like all good startup stories. At its core, my yeah, my journey started as my entrepreneurial journey started really prior to Scale. I had, as I mentioned, I graduated from college. As I was in the film space, and I really almost jumped into the entrepreneurial world out of a state of ignorance, and wanted to create a company to really solve a problem that I was seeing in the market, and was fortunate enough to be a part of a team that was able to keep that company alive and continue to grow it over a number of years. And then as I transitioned from being early mid-20s entrepreneur to being a late 20s 30-year-old entrepreneur, my what I cared about or my passions were really evolving as well. And so as I was going on to that next journey, next stage of my career, I really realized that my passion was working with entrepreneurs, working with innovators that were really trying to tackle big systemic challenges. And so I looked at health as, even prior to COVID, as really that big area that needs a tremendous amount, that big industry that needs a tremendous amount of work. And I thought, well, being an art major, I don't have any MDs or PhDs or, any other, letters at the end of my name. So what can I do that really drives impact in this space? And for me, my secret sauce was working with those people to bring them together and understand, like, who do we need to have around the table to be able to move this industry forward, to really drive progress, drive impact here. And so that's where Scale came from, was really being this convener. And in its earliest days in 2018 and 2019, it was literally around a table, generally around the table that I'm sitting at right now. And we would bring together investors, we'd bring together government entities, entrepreneurs, advisors, thought leaders, and we wanted Scale to be that table on which the deals actually got done. And we were able to see a lot of amazing momentum and progress there. And then certainly with COVID, we had to look at how does this shift to a virtual world where people aren't as inclined to be coming into an enclosed space and hugging and shaking hands and doing all the work in the way that we were so used to working for the past 100 years. And so we evolved into being this more of a digitally driven, technically driven ecosystem, addressing the exact same goals, but doing it in a way where we're able to leverage our platform, which we call the ScaleHealth Architect, to understand at a data-driven level where entrepreneurs are at in their growth, in their traction, in their journey, what resources they need to continue to be able to accelerate their growth, and then which partners they should be meeting with for pilots, for implementations, to really get their solution into the hands of people that need it the most.
Yeah, so that's great. You're bringing together investors, founders, all these different types of stakeholders together, and actually helping them get deals across the finish line so that they can make a real impact in patients' lives. It's an incredible story you just shared. So what is, for the people that aren't familiar with ScaleHealth, what is the typical gist that you give them? What is ScaleHealth to you, and what is ScaleHealth going to become for the next couple of years?
Yeah. So our elevator pitch is that we're a health innovation marketplace. And so there's two sides of that. Well, there's three sides of it. On the one side, we're a membership-driven organization. So we work with innovators, entrepreneurs, and in the health space, any stage in their journey, from very early stage to growth stage, anywhere around the world, whether they're in LA, in Pittsburgh, in the UK, in Vietnam. And we connect them with the right resources to accelerate their growth. That's one side. On the other side of our marketplace, we work in more of a consultative relationship with health organizations, payers, providers, corporations, governments, institutions, academics, to understand what their needs are, and then at the right time, connect them with the right members, the right startups, then meet those needs and do it in a way that saves time and saves money on both sides. Now, over all of that is our technology platform that enables us to do that at a very, very large scale. that's what we do now. We've seen our companies, our startup members raise over $1 billion in the last 2.5 years. We're seeing pilots and partnerships going from first meeting to implementation in as little as 3 and 4 months, which is, I feel like in the health industry, down from 3 or 4 years. And we're continuing to do more and more of those type of deals and engagements on a daily basis. In the future, where we're going is really looking at, one, just making sure that we have line of sight to every health innovation solution that's out there. If you're coming to me saying, what are the best behavioral and mental health solutions available that are at the seed stage right now, I want to be able to say, okay, here's the 3 best around the world that you need to know about. So from a growth standpoint, we want to have line of sight on all activity in the industry. And then from an operational standpoint, we are, as I mentioned, like right now, we can essentially are connecting entrepreneurs with strategic partners. Where we're going next is connecting entrepreneurs with strategic partners, getting them on the same side of the table, to go back to that table analogy, and then getting them working together to leverage our architect as a means of being able to address big health equity and social determinants of health challenges that they're facing. So how can a group of entrepreneurs work with a like-minded corporation or health system to address homelessness or mental health, or any aspect of racial health disparity that communities are facing all around the country, all around the world. So that's kind of where we're going.
So, you talk about, disparities and just, different communities having different quality of healthcare. More broadly speaking, what is the biggest challenge that the healthcare industry is facing today, in your opinion?
Whew. Big question.
Big question.
Let me think about that for a second. I would say that I think the opaqueness of it, really. I don't think no one will, just that I know of, there's no one out there that will say like the healthcare industry, specifically in the US, is flawless and seamless and smooth, and everyone has access to the care they need and everyone can afford it. I think like no one will say that that's the case. Everyone will say, yes, there are a million ways where the system can be improved. The opaqueness of it and the challenge of it becomes, while we all agree what many of the challenges might be, and we all agree on that these challenges exist, and we all understand that there are solutions out there, and let's say the solutions are in many cases innovators and entrepreneurs. The challenge is, how can we better educate the entrepreneurs on how to work with the stakeholders and with the systems? How can we educate the systems on how to incorporate innovators and entrepreneurs? Because you're often dealing with complexities on top of complexities. If you're a startup trying to sell into a hospital, understanding who your champion is, who's your user, who's your decision maker within a hospital, and then in many cases a startup not even necessarily realizing that the hospital is probably not even the one that's actually going to be cutting the check for you. That type of challenge is so different than creating a D2C solution that you can just where you can just stand up an e-commerce platform on Squarespace and start selling. It's just so much. It's the complexity of it. It's just the sheer opaqueness and complexity of it.
I could definitely relate to that at EasyPT. We, bringing together researchers, physicians, payers, all these different folks. And at least for me, not knowing the landscape coming into it is definitely a huge challenge, and figuring out who those key decision makers really are and adopting new technologies and others. So that's definitely very relatable to, I think, a lot of founders that are listening.
Yeah, it's a beast. And I think, and that's what we try to do a lot of. Like, we're trying to constantly, in our architect, our goal is to be able to provide the right information to the right startup at the right time. And so how can we take a startup by the hand and say, okay, let's educate you on this piece of information that you need to know now. Like, if if you're going through a regulatory journey, you need to know this about the FDA at this point. Or, if you're looking to sell into a hospital, do you know, like, this is how you need to be thinking about your reimbursement codes, or this is how you need to be thinking about the way this particular org is structured, or this is how you need to be approaching a sales cycle, or do you even know that the sales cycle could be 2 or 3 years long? Is that, and that's to even get a contract, let alone when it's actually going to be implemented, which might be another 2 or 3 years after that. Is that the path that you want to take, or can we make some tweaks right now that might cut that sales cycle down, fivefold?
And going back to what Scale does, you're bringing together, experts across, healthcare, people that understand the regulatory landscape. You're bringing together investors to make sure that these processes happen as smoothly as possible. So, there's clearly a big need for, what you're building here. Shifting gears a little bit, what do you think the most important lesson you've learned as a founder is, and sort of just as a human being, over the years of shifting from art to healthcare, you've probably picked up a lot of information and have learned a lot of life lessons. What would you say some of the most important lessons or lesson that you learned would be?
I'll give two, but they're pretty much the same thing. Don't burn bridges, at all costs. And I heard an expression that's really stuck with me. Your network is your net worth. And I think that's completely true. And connecting those two thoughts together, like for me, I feel like my ability to bring, not only bring smart people around me from a team standpoint, people that I really enjoy working with, whose opinions I really value, who are really able to collectively work together to drive ScaleHealth forward, but then surrounding that group with innovative people that are just know how this industry works, who really care about it, who really care about supporting people, who really care about enabling each other to succeed. I feel very fortunate enough to be able to, call many of those people friends and colleagues, and I can call on them and say, hey, I'm thinking about doing this. What do you think about this idea? Do you want to team up here? Do you want to partner here? And so knowing who's out there, knowing the strengths of people, knowing who to turn to, knowing the influential people that you can turn to with a harebrained idea, that when you just want to bounce an idea off them, or knowing which people you need to go to with a more refined idea, and understanding the dynamics there. I think that's crucial. And then, the second point, or just around not burning bridges, is like, be a good dude. Just try to I try my hardest to be someone that people want to work with. And I think that's the entrepreneurial journey is so hard. It's so stressful. It's often so lonely. There's so many aspects of it that are confusing and frustrating and energizing and depressing. It's just like, it's the roller coaster journey that our analogy that everyone gives. It's absolutely true. You need to be the type of person that people want to stick with through those highs and lows, and because it's so easy to jump off the train at any given point. And so trying to be that good person that's, a good person to work with, a good person to collaborate with, I think is critical.
Absolutely. That's great advice. One of my next questions was going to be what would be your advice for young founders? And I think you hit that right on the nail here. So I guess as a follow-up to that, what would you say the highest high and the lowest low moments were, I guess for you at ScaleHealth?
I want to give one more. So on the last question,
Sure.
This piece of advice goes for young founders. A friend and investment colleague of investment partner of ScaleHealth, Marcus Whitney, came up with he was leading a roundtable session for our community, and he made a great analogy that has stuck with me. So I'll share that as my piece of advice for younger entrepreneurs. He said, entrepreneurism is really a career, and it's thought of differently than a regular career. So many other careers, if you go into finance, you start off, you come out of college, you start off on the bottom rung of the ladder, and you work your way up, and everyone kind of knows, okay, this is my career, and I'm going to continue to progress and continue to grow. uh, the entrepreneurial journey is so different, because so often you start at the top of a ladder, but it's a very small ladder, and then you're trying to get the ladder to grow. um, I think that a piece of advice that Mark has shared with our community that I'll reiterate is, like, earn your stripes. You know, you don't need to hit a home run right out of the gate on your very first company and retire by the time you're 25. Like, everyone knows those stories because they're flashy stories, but they actually happen very, very rarely. And more often than not, the successful entrepreneurs are actually in their 40s or 50s. And so, um, earning your stripes, like, be willing to, give up equity to surround yourself with senior people that really know the space. Like, be willing to sell your first company small, and then, like, double down. You've got a win under your belt. You've got a couple stripes under your belt, and then continue to grow from there, and really look at it as a career versus a Hail Mary.
That's I think that's great advice. A lot of, founders in their 20s, I hear this really commonly. And even just being out in LA last week during this whole crypto craze, I remember just hearing founders talking about raising ridiculous rounds and looking to sort of exit and retire in their 20s, just like you said. So I think that's especially in the healthcare space, the sales processes could take years. So, I think being patient is a big part of the game. And that's great advice that I'm definitely going to take with me as well.
Yeah. And then I think, to your other question about the highs and lows, let me think. I think probably a low, and I'm sure I know I'm not the only one that's experienced this low, but I think that the early days of the pandemic, when, because prior to the pandemic, we were very focused. Our model was very focused around the physical space that I'm in now, and that you visited a week or two ago when you were here in LA. And that was kind of what we were. That was our identity. We were much more of this innovation space in Los Angeles for healthcare and healthcare innovators and entrepreneurs. And then when COVID hit, obviously it became very clear, over 2 or 3 weeks, and we had to go from having a robust community to canceling our summit that was scheduled for March to, temporarily shutting our doors. We had to think, from an identity crisis standpoint, like, one, how are we going to continue to keep the lights on and keep the team paid? But then, what does this look like for us moving forward? Are we going to try to just batten down the hatches and ride this out? Or are we going to try to pivot? And fortunate enough, again, going back to how fortunate I am to be working with an amazing group of people, we were able to pivot and continue to see the silver linings of the challenge and of the pandemic, and support as many people during that time as possible, and continue to. Now we're fortunate enough to be growing really quickly in this new direction that we have. But I think those times of just sitting back, going, wow, not only is this a really scary time and hard time from a cultural standpoint, from a health standpoint. At the time, I had a 1-month-old daughter, and so, like, navigating all of that at home, like, we're also thinking, like, what does this mean for our company that was really growing quickly, and now it's kind of had the rugs pulled out from under us. So that was a tough couple weeks, and again, I just give all the credit to the team for buckling down and finding our way through it. As far as a high goes, so I guess that's a low with a silver lining. As far as a high goes, we've done some really cool things. I mean, we were fortunate enough to have Vice President Harris come through the office. That was really cool. But I think probably a high, well, pretty much any time we hear of a success story within our community, that never gets old. The one that just happened recently, there was we just announced that we're working with rural hospitals in the state of New Mexico as their health innovations partner, and recently one of the hospitals there in Lovington, just outside of Roswell, just announced that they were working with one of our startups that we identified as addressing their needs that was actually based in the UK, out of Oxford. And so being able to understand that rural hospital's needs, understand that the best solution for them was this amazing startup called Cardmedic, based out of the UK, bring the two of them together. And now that solution is supporting the hard of hearing, our hearing impaired patients in this rural community in New Mexico. That just feels great. And that never gets old. That's an ongoing high.
That's incredible. That's incredible. And so I guess in terms of what's coming next for ScaleHealth, what do the next couple of years look like? You mentioned a little bit earlier, but what are sort of the top of mind things for you? And, what do you think's going to be exciting, difficult challenges that you're going to overcome?
And I think it's a lot of, for us, the next steps are, what I mentioned around working with these corporate partners and startups to really, really drive impact at scale, with a small s scale. And what I'm excited about there is that it kind of gets back to delivering on our core promise of empowering entrepreneurs to tackle systemic challenges in their community. That was what we were founded on back in 2017. And now we finally have the technology, I feel, and the brand and the ecosystem to really deliver on that, both locally here in LA, also in New Mexico, and in communities all across the country and all around the world. So we're just now at a point where we're starting to have really exciting conversations with some amazing corporate partners. The startups are getting really excited about it. The solution is getting there. Our architect is getting there, getting to the point where it can really deliver on this at a very, very high caliber. And so that's what I'm excited about. And then kind of getting that process going, and then really repeating that for any number of challenges that are facing communities all around the world, whether it be very localized challenges, like this example in Lovington, or global challenges like COVID.
So before we wrap up here, I have one final question. In one word, how would you describe yourself?
One word: optimistic.
Awesome.
2 words would be painfully optimistic, probably.
That's great. And so, Taylor, it's been great having you here today. Thanks for coming on. Where can listeners find you online? Where can they follow you, and where can they follow ScaleHealth?
Both most actively on LinkedIn, probably Taylor McPartland. I'm pretty easy to find there. I'm also on Twitter, although I'm probably a pretty boring tweeter to follow, at Tay McPartland. Those are my 2 spots. And then ScaleHealth is the same. We have a great active community on LinkedIn, but also for any entrepreneurs listening that are in the health space, it's free to sign up and be a part of the ScaleHealth family. So join us at scalehealth.com, and would love to support them on their journey.
Awesome. Be sure to follow along Taylor and ScaleHealth's journey. Taylor is one of the most interesting people in the world. Thank you all for listening, and follow for more.
Thank you.